Good afternoon, everybody. We're going to give it just a minute more before we start today's presentation. All right, guys, we'll go ahead and get started today. Thank you, everyone, for joining us today for our webinar, QPP 2025 Tips for Successful Attestation Preparedness. Just a few items before we get started here. If you do have any questions today during our time together, you can go ahead and drop those into the Q&A. And if we have time at the end of our presentation, we'll get to those. And if not, one of our advisors will be in touch with you to answer those questions. I would like to let everyone know that the information contained in this presentation is for general information purposes only and does not attempt to provide medical, mental health, or any other type of healthcare service. This presentation is not intended to be an alternative to medical treatment, and the content of this webinar may not apply directly to specific circumstances. The information provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representation or warranties of any kind, express or implied, about the completeness, accuracy, reliability, or suitability with respect to content. All right, and your presenters today for your presentation are myself, Tabitha Hanlon, and my fellow advisors, Alicia Anderson and Vance Drakeford. And we are going to be, again, talking about attestation preparedness. So as we get into today's topic, we're going to discuss how to find your eligibility and an overview of the program requirements for 2025, as well as how to plan for your attestation. We're going to talk about some checklists for each category and cover hardships at EUCs and some other resources that you guys may find useful. All right, so first we're going to go into the overview of our eligibility here. So for QPP eligibility requirements, there are a few things that have to happen before you're considered a MIPS eligible clinician. So first, you have to be one of those MIPS eligible clinicians and meet those determination factors. You also have to exceed low volume thresholds. And if you look a little further down on your screen, for the MIPS clinicians only, that's going to be $90,000 in Part B billing, 200 Medicare patients, and 200 covered professional services. And then for your alternative payment models, it's going to be, you have to be an advanced APM participant, have 50% of your payments tied to Medicare and 35% of your Medicare patients, or 35% of your patients be Medicare patients. You also have to be enrolled as a Medicare provider before 2025, and you can't be a qualifying APM participant for the regular MIPS track. So if you meet all of those different things, then you're a MIPS eligible clinician. And you can look down below in the blue box, and that gives you all of the different MIPS eligible clinician types. So sorry about that. And down at the very bottom, our submission window for the 2025 performance year is going to be January the 2nd of 2026 through March the 31st of 2026. All right, so on this slide, it is going to show you where you look within the QPP site to see your eligibility and determine the details about your low volume thresholds. So when you get to that main landing page, you would click on eligibility and reporting on the left-hand side of your screen. And the practices that you're the security official for are going to, or the ones that fall within the 10 will be listed there. And you can click on view practice details and clinician eligibility, and then you can view the specific eligibility criteria for the organization or practice, and also for those individual clinicians that fall within those organizations. As you can see under the practice name, the low volume threshold criteria are listed out, as well as any special statuses that are assigned to the group. And below that, a little further down the screen, there's a connected clinician section. So if you scroll down, you can see the breakdown of each clinician that falls under that specific tax ID MPI combination. And it's going to give you the detailed eligibility information, and then any special status for each of those, as well as if they're connected to any accountable care organizations. And then at the very bottom of the screen, there's an option to download that connected clinician list, and that's really useful. And it can also be used just as proof if you're, if you have an audit or anything, you'll have those connected clinicians downloaded and the date that you download those. All right, so now we're going to get into final eligibility determination. So on this slide, there's a screenshot that was taken directly from QPP.gov, and it explains how CMS is using those two snapshots, to determine whether you're exempt from reporting or required to report. So if you're below the low volume thresholds for both segments, you're MIPS exempt, so you're not required to report at that point. That also applies to those that are only above low volume thresholds for one segment or another. However, at the very bottom of that graphic, if you are above low volume thresholds for both of those segments, you're considered MIPS eligible and you're required to report. So we do recommend that if you are above low volume thresholds during either segment, that you're prepared to submit. Also, it's important to note that the final determination is what ultimately decides your fate. So no matter what segment 1 or segment 2 says, just make sure that you're relying on that final determination regarding whether you're required to report or not. All right, so this next slide is going to cover the category weights and the payment adjustments. So for the 2025 performance year, your payment adjustments would apply in 2027, which is the payment year. So the category weights and things have stayed the same for the last few years. Those haven't changed. But we did have a change to the PI category a couple of years ago, where the performance period, the number of days within the performance period changed to 180 days instead of 90 days. So that still applies for 2025. For your payment adjustments, if you score between 0 and 18.75 points, you're going to probably get that full negative 9% payment adjustment on your 2027 claims. If it's 18.76 to 74.99 points, you're going to fall within negative 9 to negative, anything below 0 to negative 9% adjustment, depending on where you fall within that range. And then if you get 75 points, which is threshold, you're going to get that standard Medicare rate on your claims for the 2027 payment year. And then if you get 75.01 to 100 points, depending on where you fall within the scale there, you're going to get up to 9 percentage points, depending on where you fall within that range. So that's kind of how the scoring and the payment adjustments fall for the MIPS program. All right, and now we're going to touch on just reporting category basics really quick before we move on into our next portion of the presentation. So for quality, the raw category points is 60 points, plus any administrative claims measures, So there are several admin claims measures, and that could add, depending on how many you're scored for, an additional 10 points per each administrative claims measure. Um, and then your category weight is 30%. If you're a small practice and you do the small practice reweight, it would increase to 40%. The number of measures that you have to submit for the quality category is going to be 6 measures, unless you're reporting as an MVP, and then it would be 4. There are several different ways to submit for the quality category, depending on, your vendor capabilities and whether you have a registry and things like that, but they're all listed out there. The reporting time frame is 365 days. And if you are reporting ECQMs, you are required to use the ONC CERT criteria to report that. For the cost category, it's going to vary depending on the number of cost measures that you're scored on, what your raw category points would be. There are 35 cost measures that are included within the cost category that you could be scored on. If you meet attribution and case minimums and all that good stuff. So it could be up to 350 raw points, depending on if you got all of those cost measures scored. It is 30% for the category weight. The category weight for small practice flexibility doesn't change for the cost category. There is no submission required for the cost category. It's all dependent on claims that are submitted. It is 365 days for the reporting time frame. I had already mentioned that it was based on Medicare billing claims during the performance year, but for improvement activities, you have 40 points that are available in that category. Your category weight's going to be 15%. If you do take the small practice reweight, it's going to change to 30%. For those that are that have a special consideration of small, rural, non-patient facing and HIPSA, you're going to report 1 measure for improvement activities. And for all others, they're going to be required to report 2 improvement activities. There are 3 different ways to attest for that. You have a 90-day performance period, and of course, 50% of your eligible clinicians have to participate within that activity for it to be valid. And then last but not least, we have promoting interoperability. For that one, we have 100 points that are available to be scored within that category. There's a 25% category weight. And of course, if you do take that small practice reweight, it's going to be reweighted to 0, and those points will be distributed to those other 2 categories. You have 4 objectives that you have to report for, and then those attestation statements. The submission is going to be the same for PI as it is for improvement activities, those 3 same ways. Your reporting time frame is 180 days. And then, of course, you have to use the ONC CERT criteria in order to report for the promoting interoperability category. And with that, I'm going to pass it over to Alicia, and she's going to talk to you guys about planning for successful attestation.
Thank you, Tabitha. When we start planning for our attestation, one of the first things we want to do is determine how we're going to participate. And we can participate a couple different ways. We can participate as an individual, as a group, as a virtual group. There's also an option to report as a subgroup if you are going to be reporting a MIPS value pathway or an MVP. Just to note, though, if you are going to participate in an MVP, you need to have advanced registration completed for that. And then you can also participate via the APM performance pathway. So what does this mean for me, and what is going to be the best choice? So if you report as an individual, you would be reporting as an individual eligible clinician underneath your TIN and NPI combination. It's really important to note here, if you are eligible at that individual level, you must submit for QPP. And if you submit as an individual, you have the opportunity to really submit the measures that you are performing the best in. It's just important to note with that, though, that your EHR can support an individual submission, and that it can pull out your data just for you. When you submit as an individual, you would receive the score as well as the payment adjustment that's based on your performance as an eligible clinician. And then next, you can submit as a group. And a group is going to be 2 or more clinicians who have reassigned their billing rights to a TIN. In this scenario, you would receive the score and payment adjustment that is assigned to the group. Most of your EHRs are going to default to this group reporting, so functionality is really not as big of a concern with group reporting. And then another perk with groups is that if you have clinicians who are not required to participate, they would still be able to receive a payment adjustment. So if your practice is performing really well, this can be a helpful way to get that incentive for those clinicians who might not otherwise be eligible to get it. And then you can submit at both that individual and group level. And if you were to do this, you would receive the higher of the 2 scores and the associated payment adjustment for that. So that's something to consider as well. You can kind of get in there and look at your performance rates, look at what your EHR is capable of, and choose the best path that way. And then finally, we have our virtual groups. And our virtual groups are just going to essentially be a combination of 2 or more single eligible clinicians or small groups that kind of join together virtually and participate in MIPS. If you were to participate this way, you would need to register in advance. And you'd have to be able to aggregate all your performance data for all of the clinicians. It's not a super common participation level, but if it's something that you're interested in, it is available to you. So deciding how you want to participate is really just the first step. Here we have a list of things to start considering and preparing for as we begin to move towards that attestation period. You're going to want to start by making sure you can access the QPP portal, especially if you haven't in some time. The QPP portal does require regular password changes and a multi-factor authentication. So making sure you have that all set up and you're able to access it will really save you some time when you're trying to log in for attestation. If you're new to the QPP portal, it's going to be important that you ensure that you or someone else in your practice is the security official that is attached to your TIN, so you can actually complete that attestation. And then once you're in the portal and ready to go, we do recommend that you review your attached clinicians and really look at that eligibility. This step can also help you decide which participation levels you want to consider and ultimately choose for your attestation. And then next, you're going to also want to make sure that you're all set up in PACOS and that you have access there. You're going to want to make sure here too that there is somebody designated for maintenance as those providers come and leave your practice. It's going to really be critical in making sure that your connected clinicians remain correct throughout the year. And then early on, you're going to want to start thinking about your documents to retain for each performance category. As we move into the presentation, we'll have more details on what those documents look like in more detail for each category. But to start, it's important to at least decide where and how you want to keep that documentation. So are you going to have a physical folder or an electronic file? If it's electronic, where is it stored and who can access it? We want to make sure that we can access this information for at least 6 years. So keeping documentation on just one staff member's desktop can become a little bit problematic if that person were to leave the organization, or even if there's computer malfunctions. 6 years is a really long time to trust that desktop to hold our important documentation. And it's also important that where we store the information is going to be accessible to anyone who might need it now or for years to come. And then finally, our chapel ID. You can find this at the chapel site at healthit.gov. And we have that address on the slide here for you. This will allow you to walk through the components of your EHR and get your cert ID. That's going to be required for attestation. This can be a little bit challenging sometimes, so please don't hesitate to reach out to your advisor or your vendor to get help building that chapel ID. And it's also important that we start making some considerations on how we're going to submit our data. So CMS is somewhat flexible here and does allow for multiple collection types, which is great. But we just need to make sure that we have a plan on what we want to submit and how. So we need to work with our vendors to understand how we will receive our QRDA3 or JSON file that we need for submission. Is the vendor going to generate it for us, or do we need to generate the files ourselves? If we're working with multiple EHRs or measure types, we're going to need to do some aggregating, and all that's going to need to be done through an approved vendor or registry. And we're going to want to make sure we're having those conversations early as well. And we need to decide who is actually going to upload the files for each performance category. So we need to know what types of files we will be receiving, or do we need to generate them on our own for quality, promoting interoperability and improvement activities? And then we will determine who's actually going to submit them to CMS. Will we be handling our own attestation completely, or does the vendor do any submitting on our behalf? So Tabitha talked to us a little bit about each category. And just as a reminder, with both promoting interoperability and improvement activities, we have that option to log in a test. So we can simply just log in, enter our data directly into the QPP portal. We think that is a great option. So it's just as important that we communicate with our vendors, like very specifically, if we do not want them to submit data on our behalf. It's just as important as letting them know if we do want them to submit anything for us. And this is just a quick table that shows us our quality submission types and who can submit them. And so starting out with our ECQMs, and these are our EHR measures. There's just a few things to note. Your EHR must meet the 2015 Cures update criteria. And then you must be using the most recent updated version of the measure. Any participation level can submit ECQMs, and you can submit them yourself, or a third-party intermediary can submit them on your behalf. Just as a reminder here, though, if you're going to submit as an individual eligible clinician, you would need to be able to have those performance rates at your individual clinician level, and then generate your QRD3, your QRDA3 files to represent that. And then next we have our MIPS CQMs, or our registry measures. So you might be working with a qualified registry or a QCDR and using measures that are applicable to your practice and your specialty. This option is also available at all participation levels in your registry, or your registry can be the one who completes the submission, or you can. Our QCDR measures are going to be very similar to our registries and provide you access to those additional QCDR measures. The real difference here is that the QCDR or your third-party intermediary will need to be the one who submits those files during your attestation. If you are a small practice using claims for quality submission, you will not need to generate and upload any files at all for your quality attestation. Your performance will be calculated by CMS based on your Part B claims throughout the performance year. And then last, we have our CAPS for MIPS survey. If you are participating in the CAPS for MIPS survey, you would have had to register for that. These are going to be administered by a CMS approved survey vendor, and there are case minimums that apply for you to be able to be scored on that. So if you have this as a measure, you're always going to want to report an additional quality measure for a backup, just in case you do not meet those case minimums. And again, we just really recommend knowing who your vendors are early on and beginning to have those conversations as soon as possible, so we can fully understand what needs to be submitted and by who. And your advisor is happy to help guide you through these conversations as we prepare to submit. We've talked a lot about talking to our vendors about how we're going to get our files and who's going to submit them. But there are also other important questions that we should really be asking our vendors early on. So we want to understand the timeline, so we know when we can be expecting to receive our files or when we'll be able to generate them. So we can really begin to kind of plan our attestation around that timeline. We can't submit until we're able to access those. And then we also want to ask questions about the process. If we are going to be the ones who are responsible for generating any of our reports, how and where do they generate, or will we generate them from? Are there any instructions or workflows that they might have available to make that process smoother for us? And then what does the support look like if we run into any challenges when trying to generate those reports? And then we also want to see if there are any associated costs with reports. Are there going to be costs for them to provide us with reports or go in and upload for us? These are just some considerations that we can make when deciding how we want to get our reports in a test. If there's additional costs for pieces of it, maybe there's pieces that we can do ourselves and we can avoid those additional costs. And finally, if you are ever chosen for an audit, what does audit support look like? How long is your vendor going to keep your data in reports? Would they provide hands-on support for you? What would their involvement look like in the case of that audit? That's also why it is so important that we have our documents retained safely on our end for the entire audit period. So what exactly do we need to retain in our records in case if there were an audit? Once we have decided how and where we're going to retain those records, we want to make sure we have copies of all the reports we submitted and then screenshots of any data we manually entered. So for example, if we did do a login and a test for promoting interoperability, where did we get those numerators and denominators from? Even if we don't have a report that we uploaded, we want to have a screenshot that shows all of that data. In a minute, Vance is going to walk us through the category specific information checklist. But for the purposes here, if it was submitted or entered, make sure you have a copy or a screenshot saved somewhere. And then once you do your submission in the portal, make sure you download all available files and save them in your binder or your file location. And then grab screenshots of preliminary scoring information that you're going to get once you complete that attestation. And you'll be able to see that for all categories that you attested to. So just grabbing those screenshots will be super helpful. And then we do recommend, if you're going to have an electronic documentation retention process, that you also have a binder where you can keep hard copies of those files. And then if you're using an electronic version, make sure you're using a naming convention that's easy to recognize. For example, you could include the category name and year in your files to make them easy to identify if you do need to find them in the future for an audit. And again, just a reminder that staff does change. So keeping up with your QPP portal and making sure that someone always has access is important. And then finally, we just have a few tips and tricks for anyone who might be submitting for an MVP. Starting with quality, ensure that your quality submission file includes the measures that you are using within your MVP. And then also for this category, making sure that if you're reporting as a subgroup, only those clinicians that are participating in the subgroup are included in your submission file. If subgroup reporting is something that you're considering doing, these are conversations that you definitely need to be having with your vendor very early on. Promoting interoperability will be an attestation at the TIN level, so you'll not need to pull out any MVP participants there, even if you are going to submit as a subgroup. And improvement activities with an MVP are still going to require that you submit one activity, and that activity needs to cover at least 50% of the eligible clinicians in the MVP. So if you're a subgroup, 50% of those eligible clinicians who are in that subgroup participating in the MVP needs to be included in the improvement activity, and you should have supporting documentation for that. And then just a few additional notes for subgroups. You would still receive any special statuses that are assigned to your TIN, and then your population health and cost measures. Those are also going to be scored at that TIN level. So CMS will not be pulling out individual scores and aggregating those for clinicians who are just participating in the MVP. You will get that TIN score for those. Now I'm going to pass it off to Vance to help us walk through those attestation checklists for each of our categories. Thank you, Vance.
Well, thanks, Alicia. So let's dive into this. Alicia, I know, just spoke about, what to prepare for, documentation. And now I'm going to kind of dive into each category for some more specifics on that. So, when you're thinking about quality reporting, there are a few things that you'll want to make sure you've got saved, just in case you're ever audited. So a good rule of thumb is to hold on to all of the quality reports that you've generated during the performance period. But at the very least, make sure you keep a copy of that QRDA3 file that you submitted. and make sure you save that into your manual or your file for your attestation for the year. Now, once your list of NPIs and locations is finalized, go ahead and save that too. And really, another pro tip, it's really smart to take a quick screenshot of your submission on that QPP site. That way, if any questions or issues come up later, you're going to have proof of what you submitted. So after you hit that submit button, that QPP site will give you a preliminary score. Save that too. It's going to give you a pretty good idea of what to expect when those final scores comes out. And then lastly, once CMS releases that official score, make sure that you download and keep any of those feedback reports, data files, and payment adjustment details for your records. That's going to be really important. So looking at improvement activities, one of the biggest things to keep in mind here is documentation. You want to make sure you've got a solid proof for every activity that you've selected and attested to. Now, the type of documentation is going to vary depending on the activity. So it's really important to take a look at that data validation criteria included in each measure, because it'll give you specifics on what type of documentation CMS is requiring. And it's going to be necessary to help back up your submission. Now, whatever you decide to save, whether it's, a report, a screenshot, or some sort of training plans, possibly, make sure that your timeframes are clearly shown in those documents. That little detail can make a big difference if your data is ever reviewed. So if you're submitting as a group, here's a tip. Include a list of all of the NPIs who participated in each activity. And that's going to demonstrate that at least 50% of your eligible clinicians were involved in that same activity, which is a requirement. And just like with your quality reporting, don't forget to grab a few screenshots along the way. Take one of your submission, your preliminary score, and any feedback reports or payment adjustments that get applied later. Keeping all of that together is going to make your documentation complete, and your life's going to be a lot easier if you're ever needed to reference it later on. So moving on to promoting interoperability. The checklist for this category looks a lot like the others, but there are a few key things you'll want to pay close attention to. So make sure first that you keep a copy of that PI report that you plan to attest to that data for the PI category. And then look at the report and confirm that you selected that 180-day reporting period and that it's shown on that report along with the NPIs. That information is important in case you need to verify the submission. You'll also want to save copies of any agreements for your HIE measures or public health reporting, documentation of your security risk analysis, and any manual data calculations you may have done. Those details are all going to support your submission if it's ever audited or reviewed. And so another big one to keep in mind is you want to double, even triple check your cert ID. Make sure it's current. So check with your Chapel check with the Chapel website to confirm. Otherwise, you could end up with a 0 in your PI category, which nobody's wanting to see that. So confirm that. Speak to your IT vendor for your EHR vendor on confirming that you do have the correct chapel and everything that's included with those that piece of the puzzle. And then finally, just like with the other categories, hang on to any preliminary scores, your EHR reports, feedback reports, or any data files that you've received or after you've submitted. And keeping all of this organized in that file up front makes it a lot easier to respond to questions or audits later down the road. So we've kind of talked about everything that you need to save, but how long do you actually need to keep it all? So CMS, they do reserve the right to audit you for up to 6 years after the performance year. So it's really important to have that solid storage plan in place. You may remember what you did last year, but if you're not audited until 5 years down the road, you're not going to remember those details. So it's really important that you have that file, electronic file, a paper file, doesn't hurt either. And keep it all in one place so you know exactly where it's at. And like I said, keep an electronic and a paper copy of your files. And I would create a binder and label it QPP with the program year right on the front. That makes it, really easy to grab if you ever need to reference it. And for your electronic copies, save them in a shared location so that others on your team can access the files if necessary. Now, you want to make sure both your paper and your electronic copies are stored safely and securely. And another tip, keep a transition plan in those files. That way, if you have staff turnover, new team members can quickly, get up to speed and keep things running smoothly with that. And as I said earlier, your advisor has some tools and resources that we're happy to share soon and help you guys review your attestation and audit preparedness. And, of course, if you have questions, you can always reach out to us with your advisor because, we're happy to help. Well, okay. So we've talked about preparing yourselves. Let's change gears a little bit and talk about some reporting flexibilities that are available. So as we talk about EUCs and hardship exceptions, it's kind of helpful to understand how those categories get reweighted. You're going to see here on the slide that some of the most common reweighting scenarios that can happen. And one thing you want to remember or keep in mind is if you're only submitting 2 categories, that doesn't automatically mean, okay, my slides are advancing on me here. If you only submit those 2 categories, it doesn't mean that you're only going to be scored or each category would be worth 50%. They will be reweighted accordingly. And this is a really good reference to what to look at on how to do that. Now, the QPP program, puts a strong emphasis on quality and cost. So if you're submitting on one of those categories, it's going to take on more weight than the others that are being reported. So if you're thinking about applying for a reweight, be sure you talk with your advisor first so we can help walk you through how those changes might impact your final score and really help you make that best decision for a specific situation. So, what exactly is an EUC? That's referring to an extreme and uncontrollable circumstance. This is an extreme and uncontrollable circumstance are defined as rare events entirely outside of your control and the control of the facility when you practice or where you practice. So these circumstances would, one, cause you to be unable to collect information necessary to submit for a MIPS category. They would cause you to be unable to submit information to be used to score a MIPS performance category for an extended period. So if you, for example, if you weren't able to collect data for the quality category for 3 months, something like that, or you have it impacts your normal processes. So it affecting your performance on cost measures and other administrative claims measures. So, example, if you were unable to collect data for the quality performance for 3 months, again. So when it comes to eligibility of an EUC application for traditional MIPS, MVP, or the APP, excuse me, practically anyone can apply. Individual ECs, groups, and virtual groups are able to reweight all or any of the categories. And you have until December 31st at 8 p.m. Eastern time to apply. So if you do apply for that, you will be notified via an email that your request was either approved or denied. And you can also check this in your eligibility within the QPP website. So hardships are like EUCs, but offer a little more flexibility. Hardships can be applied for any of the following reasons deemed by a small practice by CMS, as well as some other special designations listed in the blue box here on the right. Decertified EHR technology, insufficient internet connectivity, EUCs like disasters, practice closures, and severe financial distress or vendor issues. Or maybe if you lack control over the availability of your cert. Eligible clinicians, groups, and virtual groups can apply for hardships as well. And the same with an EUC. Hardships, you have until December 31st at 8 p.m. Eastern time to apply. And you do that by logging into the QPP portal using your HARP credentials. So I also want to highlight the box there in yellow because it is going to be a staple in the PI category starting this year moving forward. CMS does require that the 2015 Cures Edition update be in your cert. Not having that update is not a reason for CMS to give a hardship, and this can result in a 0 for that PI category. So questions. If you have any questions, please reach out to us and contact us at our contact your advisor or the REC. Our contact information is going to be listed here in a second. We did also want to remind you about our remaining webinars for this year for our MIPS individual assistant clients. We're having a couple more client only. One is a recording for performance feedback that you are able to access, and our upcoming December the 16th final rule is coming out. When this slide was generated, it was tentative, but at this time, I believe that's still set in stone. So here's our contact information. Please reach out to us if you have further questions, and we appreciate everything today for you joining us and hope you have a wonderful afternoon.